Okay, so picture this. You walk into a scanner, and I'm not talking about like a hospital, maybe at a pharmacy or even at home, and boom, you get this complete picture of your health. Just like that. It's like something out of a sci-fi movie, right?
Totally.
Well, maybe not so sci-fi anymore.
Right.
That's what this report, Advanced Medical Scanners, Revolutionizing Healthcare, is all about. And honestly, I'm pretty excited to dive into this one. So today we're going to like really unpack how this tech could like totally change how we think about healthcare.
Yeah, it really is a whole new way of thinking about things. Like, right now we basically just go to the doctor when we're already feeling sick.
Right.
This is about like understanding our health before we even have symptoms.
Yeah, exactly. Like getting ahead of the game.
Yeah.
I love that. Okay, so let's break this down, starting with the nitty-gritty, the how the report talks about these scanners using hyperspectral and molecular imaging. It sounds like super complicated, right?
It does.
But like for someone like me, just stepping into that scanner, what does it actually mean?
Okay, so imagine this. Instead of just taking a regular picture like an X-ray, this hyperspectral imaging thing, it breaks down the light reflecting off your body into like hundreds of different wavelengths.
Whoa.
It's like seeing a secret code in the light, and it reveals these tiny differences in your tissues that could be like a warning sign for something developing.
Oh, so it's not just looking at the structure, but actually like understanding what's happening at a molecular level.
Exactly. It's like looking under the hood, and then molecular imaging is like putting a spotlight on specific molecules in your body. Let's say you have inflammation somewhere. This scanner could basically highlight those inflamed cells, showing exactly where the problem is.
That's wild.
Yeah.
Okay, so we've got this single scan giving us all this incredible information. But how could doctors possibly make sense of it all? It seems like a lot to process.
Yeah, well, that's where AI comes in. Picture this AI analyzing your scan, comparing it to millions of others, and flagging any potential issues that even the best doctor might miss.
So it's like having a super doctor as your backup.
Kind of, yeah.
But relying on AI, does that raise any concerns? Like, what if it makes a mistake?
That's a totally valid concern, and the report talks about that too.
Yeah.
Think about it this way. AI is always learning and improving, right? The more data it analyzes, the better it gets.
Right, like a doctor fresh out of school versus someone with years of experience.
Exactly. So it's not about blindly trusting AI. It's about understanding what it can and can't do.
Okay, so we've got these amazing scanners, the AI assistant. What are the actual benefits for me, the patient?
Well, think about this. Imagine the scan flags a vitamin deficiency. You've been feeling tired, but you don't know why. But now the AI can recommend diet changes just for you.
So it's about catching things early before they become a bigger problem.
Exactly. And imagine early detection for serious conditions like cancer.
Oh, wow.
Catching it early when it's much easier to treat.
So we're talking about a whole different approach to healthcare.
Absolutely, from reactive to proactive.
Okay, it sounds pretty amazing so far. But I know there are always challenges with new tech. So what are some of the hurdles we need to think about?
Well, one of the biggest ones is making sure everyone can access these scanners, not just a select few. We have to think about cost, location, and ease of use,
Yeah, it's like any new technology.
Yeah.
Right? It starts out expensive and hard to get. How does the report address that?
It really stresses how important it is to make these scanners widely available. I mean, if this is really going to revolutionize healthcare, it can't just be stuck in fancy hospitals.
Right, it needs to be part of our everyday lives. So where could we see these scanners besides hospitals?
They talk about a few interesting possibilities, like pharmacies could become hubs for routine health checks. You pick up your prescription and get a quick scan while you're there.
That's convenient, but a lot of pharmacies are pretty tiny. Where will they even put these things?
That's a good point. And the report does mention the logistics of fitting these scanners into existing spaces. So pharmacies might need to adapt, maybe have special scanning areas or partner with bigger healthcare providers.
Okay, so pharmacies might need a makeover? What about malls? I've seen those little health clinics in malls doing flu shots and blood pressure checks. Could these scanners fit in there?
Yeah, they think malls could be great for public health stuff, like tracking the flu or offering screenings for common conditions. You're walking through the mall and boom, free health scan.
I like that idea, kind of like a giant health fair. But wouldn't it be kind of distracting to get a health scan in the middle of a mall?
It could be, and privacy would be super important. The report suggests having dedicated spaces within malls, specifically for screenings, so it's calm and private.
Makes sense. Okay, so pharmacies for convenience, malls for public health. But the report also talks about these scanners ending up in our homes. Is that realistic?
It sounds futuristic, but think about it. Home-based scanners could offer this whole new level of personalized care. You could monitor chronic conditions, track your progress, even catch early signs of illness all from home.
That's pretty incredible, but also a little scary. Would you really want to know everything about your health all the time?
That's a big question they raise in the report. It's about finding that balance between information and peace of mind. Some people might love having all that health data, while others might find it overwhelming.
Yeah, it's like a constant stream of information. We need to figure out how to handle it all. I can see how this could really empower people to take charge of their health, but it comes with a lot of responsibility too.
Absolutely. It's not just about the tech, it's about how we use it and how it fits into our lives. We need to talk about our comfort levels, our expectations, and how we navigate this new world of personalized health information.
It feels like the role of doctors might need to change too, if we have all this info. What happens to the traditional doctor-patient relationship?
It's a good question. We might see doctors become more like guides and educators, helping patients understand their data. It could lead to a more collaborative approach to healthcare where patients are really involved in their own health management.
It's like a paradigm shift from just treating illness to preventing it and personalizing care. But with any big shift, there are going to be some bumps along the road.
Yeah, it feels like we're talking about a whole new era of healthcare, like a paradigm shift.
Absolutely. It's about moving from reactive treatment to proactive prevention, and really personalizing care.
Oh, okay. But with any big shift, there are always those like growing pains and adjustments to figure out.
Oh, definitely.
What are some of the potential hurdles we need to consider?
Well, one of the big ones is ensuring these scanners are accessible to everyone, not just a select few.
Right. It can't just be for the wealthy or those with like top-notch insurance.
Exactly. We need to think about cost, location, ease of use.
It's like with any groundbreaking tech, initially it's expensive and limited. So how does the report address those concerns?
Well, it stresses the importance of making these scanners as widely available as possible. Think about it. For this technology to really revolutionize healthcare, it needs to be integrated into our everyday lives.
Right, not just stuck in some specialized facility.
So where could we potentially see these scanners beyond hospitals?
Well, the report explores a few interesting possibilities. For example, pharmacies could become hubs for routine health checks.
Oh, that's interesting.
Imagine you go pick up your prescription, and while you're there, you step into a scanner for a quick scan.
That sounds super convenient, but I'm picturing those tiny pharmacies crammed between shops. Where would they even put these scanners?
That's a valid point, and the report does acknowledge the logistical challenges of integrating these scanners into existing spaces.
Right.
So pharmacies would need to adapt, maybe create dedicated scanning areas, or partner with larger healthcare providers.
Okay, so pharmacies might need some restructuring. What about malls? I've seen those pop-up health clinics in malls, offering flu shots and blood pressure checks. Could these scanners fit into that model?
Yeah, they suggest that malls could be ideal for public health initiatives, like tracking the spread of seasonal illnesses or offering screenings for common conditions.
Oh, that's interesting.
Imagine walking through the mall and seeing a sign for a free health scan. It could really raise awareness about public health.
Yeah, that's a cool idea. Kind of like a health fair, but on a much larger scale. But wouldn't it be distracting? I can't imagine focusing on a health scan while surrounded by shoppers and all the noise and lights.
That's a fair point. The mall environment can be pretty distracting, and maintaining privacy would be crucial.
Yeah, for sure.
They suggest creating dedicated spaces within malls specifically designed for these health screenings, ensuring a calm and private atmosphere.
Okay, so we've got pharmacies for convenience and malls for public health initiatives. But the report also talks about these scanners potentially ending up in our homes. Is that realistic?
It might sound like science fiction, but home-based scanners could really change things. Think about it. You could monitor chronic conditions, track your progress, and even catch early signs of illness all from home.
Wow, that's pretty amazing.
Yeah.
But also a little intimidating. Would you really want to know everything about your health all the time?
That's a key question the report raises. It's about finding that balance between information and peace of mind.
Right.
Some people might love having constant access to their health data, while others might find it overwhelming or even anxiety-inducing.
It's like having a constant stream of information. We'd need to figure out how to process it and manage it effectively.
Yeah.
I can see how this technology could empower people to take control of their health. But it also comes with a certain level of responsibility.
Exactly. It's not just about the technology itself, but how we use it and integrate it into our lives. We need to be open about our comfort levels and expectations and figure out how to navigate this new era of personalized health information.
So it really seems like we're on the edge of this crazy new future for healthcare.
Okay.
Exciting, but also a little bit scary.
Yeah, definitely uncharted territory.
So as we wrap up this deep dive into these advanced medical scanners, what are some of the big takeaways for our listeners?
One thing that really sticks out is the potential for these scanners to completely personalize healthcare imagined treatment plans and lifestyle recommendations based on your unique genes and your current health status.
Yeah, that's a huge leap from the one-size-fits-all approach we see so often today. But this whole personalization thing also brings up those questions about data privacy and security. How do we make sure all this sensitive health info stays private and is used responsibly?
The report really emphasizes the need for strong security measures and clear regulations about who can access the data and how it can be used.
Right. It's not just about protecting individual privacy, but also preventing discrimination based on someone's health data.
Absolutely.
We need to make sure this technology benefits everyone equally and doesn't create new barriers to healthcare.
Right.
But beyond the tech stuff and the ethical stuff, I'm also curious about the psychological impact. Having access to so much information about our health could be overwhelming.
It's definitely something we need to think about carefully. Imagine you get a scan that shows you're predisposed to a certain condition, even if you're healthy right now. How would that knowledge affect your life choices, your outlook on the future?
It's almost like we need a new kind of health literacy, learning how to understand this information and make decisions without freaking out.
Exactly. It's not just about having the data, it's about knowing what to do with it. We might even see a rise in genetic counselors and health coaches to help people navigate all this new information.
So this technology could empower people to really take charge of their health, but it also comes with this responsibility to use that information wisely.
It's a delicate balance, right? We're heading towards a future where people have more access to information than ever before.
Right.
But with that access comes the need for education, critical thinking, and open communication with healthcare professionals.
So as we wrap up this deep dive, what's the one big message you want our listeners to take away?
I'd say be excited about the possibilities, but proceed with caution. This technology could completely revolutionize healthcare, but we need to have those thoughtful conversations about what it all means.
Well said. It's a really fascinating time to be exploring all these healthcare innovations. And for our listeners out there, stay curious, stay informed, and stay engaged in this conversation. It's a future we're building together. Thanks for joining us on this deep dive into the future of health. Until next time, stay well.
This is DigitView.